Welcome to Inside City Hall. I'm your host, Mayor Daryl Seymore, and today on our show we have Ron McArthur, the CEO of Summit Healthcare. Welcome, Ron.
Thank you.
Glad
it's a pleasure to be
us today.
It's a pleasure to be here with you today.
Well, appreciate it. You know, you guys are moving some dirt up there.
Yes, I drove by this morning and we're building or pouring cement for the elevator shafts on our
exciting.
medical office building. So yes, we're seeing cement, we're seeing some walls go up, and still a lot more to happen.
You know, you see the foundations and things go up, but one of the first things you have to put is those elevator shafts up, and they go up, and then everything kind of gets built around those.
That's correct, and we've had a lot of questions. Why are you digging up all that dirt? Well, the reason we're having to dig up the dirt is we have to replace the clay with engineered soil, so when we pour the cement, it'll support the structure. So we dug a lot of dirt up, hauled a lot of dirt off, and brought in a lot of dirt and packed it down, and now we're pouring the footings for all three buildings.
Yeah, that's one of the things that we have up here is those clay soils, and if you don't do that, it expands and contracts, and you don't have a very firm foundation. And so that's a lot of dirt you've moved, a lot of trees that you've had to, and that's one of the reasons why it was clear cut, because it's next to impossible to remove those type of dirts without having, with the trees in the way. Otherwise, most of them would have died anyway.
Well, that along with pouring the parking lots. There's a lot of parking that's needed as part of this project, and so it's really hard to leave the trees and build parking lots around it. But the northeast section, we did leave the trees intact. It's an area for future development. We'll be planting 300 new trees. They won't be the big tall pines to replace them, but it will be aesthetically pleasing from a landscaping standpoint with adding trees to go with the buildings.
Oh, great. Let's go back to kind of the beginning of, the hospital's been doing some great things. You've expanded, but what was kind of the decision of the board at the time? What led you to kind of this decision, and what's the main focus of why you decided to go ahead and add on?
And let me kind of just review the history of where we've been and where we're going. Okay. The Phelps Dodge donated the land currently where the hospital is built back in the late 1960s. The original hospital opened in 1970. I believe it's a 35-bed facility. Called it Navapache Medical Center. And then in early 2001, 2002, the board was faced with the decision, it's time to replace the facility. And so the decision was made, they really liked the location, so a decision was made, we're going to replace the facility on the local campus where it's at. So to do that, we've had to build it in phases. The first phase was the tower, the 5-story tower that broke ground in 2005, opened in 2008. And then we've been remodeling all of the other areas of the hospital. We acquired 20 acres of land back where the cancer center is, but it doesn't have street front. So we approached the Chapman family that were the owners of the Pine Shadows Mobile Home and RV Park, saying we would love to acquire street front property if you ever wanted to sell that. And that happened back when we were building the tower. In 2014, we got the call from the Chapmans. They would be willing to sell the property to us. It was a year of negotiations. We actually acquired the land for $3.85 million in January of 2015. We became the proud owners of a mobile home park, which, we kept the mobile home park open for a couple years. And then we hired a company to tell us what's the best use of that property. And we've always wanted a medical office building to have the doctors on campus. With everything going to outpatient services, we wanted to separate the two campuses, have our current facility serve as the inpatient campus, and then make the expansion project the outpatient campus. And it's all about patient convenience, patient's accessibility, kind of a one-stop shop for outpatient services. Go in and see your physician, be able to get your outpatient services done there, and not have to go in and deal with the traffic that's going on in the inpatient facility. So it took us about 4 years of planning before we was able to really break ground. A lot of work, a lot of contracts, a lot of negotiations. We finally transferred funds on Halloween Day, October 31st. The funding got put in our bank, so we had money to start the project, and November 8th we had people on site starting to move dirt. But the board wanted it for outpatient expansion and to have more street front property. We now have a 55-acre campus, which should meet our needs for a long term. 35 acres of street front and then 20 acres in the back.
No, that's great. So of this expansion, how many new buildings are going to be built?
Well, we come up with the Next Core was the company we hired to do the master campus development plan. They specialize in medical office buildings, but we ended up with 3 buildings is what they recommended, and the board agreed with it. The biggest building, and it's the one you can see the most work going on where they're pouring the walls, will be a combination medical office outpatient services building. It'll be 3 stories, 35,000 square feet of floor, so 105,000 square feet. On the first floor is all outpatient services. It'll have one of the new services. It'll have a retail pharmacy in it that will also be selling durable medical equipment. We'll have all of the imaging services, all of the lab services, all of the therapy services with actually a swimming pool there for the hydrotherapy. We'll have our occupational health services, cardiac rehab, wound care services. So almost everything that you would need for outpatient will be on the first floor. Second floor will be for specialists, both surgical and medical specialists, and the third floor will be for the primary care physicians. Okay. The building will actually be owned by NextCore. They borrowed $30 million to build it. We are actually leasing space in the building with options to buy the building at 5-year increments. We can buy the building at the end of 5 or 10 or 15. We didn't have enough debt service capacity to do the total $80 million project on our own. And so NextCore is doing the medical office building financing, and they'll actually own the building and be paying property taxes on the building.
On that site. So, you know, part of it, are you moving anything from the existing hospital over to this facility? Will it free up any space that you have in the existing hospital? The services
coming out of the existing hospital will be wound care services. Okay. We'll actually move into that. And then over in our East Campus, we're moving, you know, all of the occupational health services over. And then the rest of the services are currently leased around town. You know, okay. Cardiac rehab's leased. There's like 17 clinics that are moving into that building, and they're coming from other locations.
So you have a lot of people that are just kind of relocating to have their services in one place.
Centralize it, get some economies of scale, especially for the physician clinics. Having 17 different clinics, having them all on one site to make it easier for centralized registration, make it easier for, you know, all the front office functions. Right. Back office will still require the same amount of staff, but it'll give us a lot of efficiencies of scale that we don't have currently.
That's great. So currently, how many employees does Summit Healthcare employ, and with this new expansion, how many new jobs will that possibly add?
Well, we're right around, not full-time equivalents, but counting full-time, part-time, we're just under 1,200. We're forecasting probably another 150 jobs. Right now, the construction company's bringing in about 150 new jobs during the 1-year construction project. The new services that we'll be hiring, we'll be moving off of the 5th floor over to the new campus, and so we'll be adding an inpatient mental health floor, and that generally takes about 80 employees to staff a floor. The retail pharmacy is new, and then just the support services, more maintenance staff, more security, more housekeeping. All of those things will require more help to support all of the buildings on our current campus.
You know, a lot of these clinics, you know, will be moving, doctors will be moving offices, everything like that. I'm sure it's going to take a little while of adjustment, but tell me what clinics you're still going to keep open in different areas
in
of the
Sholo and Pine Top. We have a clinic down on the Deuce. The walk-in clinic will stay in place, but we will be moving Dr. Smithson and those mid-levels up to the new location, but the walk-in clinic will stay on the Deuce. And then up in Pine Top, the Blue Ridge Clinic, Dr. Paxman's clinic, and the walk-in will stay put, and everything in between is moving into the building. So, you know, we'll be the Cub Lake, have a number of, you know, we're moving out of Cub Lake, we're moving out of Lake Ridge, we're moving out of all the buildings back behind the hospital. We've told the owners there for years that we'd be moving, and it'll be a phased moving. We have leases that still run to 2021, so I mean, even if we move them all at once, they'll still be getting rent for the next 3 to 4 years before they're actually all the leases expire.
Or they find somebody, you know, in the interim
in.
and meet in an agreement with you or sublease different things that way. But you will still keep Snowflake will be open and Heber
all
will
of
be
the
open.
outlying
All those
clinics will
outlinings are
stay.
still going to stay and things
The
that
Heber
way.
Overgard will stay. The 2 clinics in Snowflake stay. The clinic in Springerville Eager stays. The 2 clinics in Holbrook stays.
Okay.
But the big building, like I mentioned, is the medical office building. The other 2 buildings, second building is going to be a freestanding surgery center. Outpatient surgery is, you know, where it's at. Most surgeries nowadays, 80 to 85% can be done on an outpatient basis. And we're going to build that adjacent to the medical office building. It'll be 16,000 square feet, 4 operating rooms, a special procedures room, and then it will be connected by a walkway to the 2nd floor of the medical office building where the surgeons are, so they can go across. The property is not level, as you've noticed, and so the medical office building is going to be on one level. The surgery center and the administrative services building is going to be on a 14-foot higher level, so we're going to have 2 levels basically on that campus. The medical office building level, and then everything above it will be on the same level. The 3rd building is what we're calling administrative services. As I mentioned, we're emptying the 5th floor of our current building so we can expand inpatient services. That means the governing board will move next door, the administration will move next door, our credentialing, our health information, our human resources. We'll also be moving accounting and consolidating off-campus accounting, and business office functions will be consolidated. We're out of meeting room space, and so we're building a state-of-the-art kind of a meeting room complex, 3,000 square feet. It'll be like a convention center where you can open it up to 200 people at once, or you can divide it as small as 10 people. So that will be an addition that we really need as we're out of meeting room. The current building for materials management and environmental services was just it's way outdated. It's right outside of dietary. We'll be demolishing it and moving it to the administrative services building, a new dock, new, you know, plant, and that building will be connected to the existing hospital. So, you know, we had somebody say, oh, we need a subway underneath to go, but we'll have the MOB and the surgery center connected by walkways, which is the outpatient, and then the support services will be connected to the inpatient building. Well, so it's really exciting.
It is. There's going to be a lot of changes finding your way around, and things will be a little challenge for people that are familiar right now with the hospital.
Yes, and the city helped us out on a ADOT sign or a stoplight application. We got $300,000 grant, and we'll be having a special stoplight that will be for the purpose of entering the medical office building complex. It will go all the way around to the back and tie into the back. So there'll be another entry point into the hospital other than Shoalo Lake Road.
So that'll be a stoplight right before
it'll be up toward Mateo's up at the north end.
That area there. That'll be good. And there are works, and hopefully someday we'll be able to redo that intersection that's currently there right now, and there is some talks in the works of making that. That's a big project to undertake, but it's something that's needed for a long time as well. Hopefully in the future that will all coordinate for traffic
and ADOT
flow.
wants us to have the timing so the stoplights will be in sync, but it'll make it a lot easier to access. We expect a lot more traffic, 200 visits a day in the outpatient building to go with our inpatient. So we may get up to Walmart in terms of be as busy as their parking lot.
Well, we hope not. For your sake, yes, at the same time there, but for people that go in the hospital. What has been kind of the goal? I know obviously you want to have more services, things that you've done. You've added, you know, the cancer center, some of these things, but are you finding that our health care on the White Mountains is improving over time with we're able to get more things, more surgeries, more procedures done locally here?
Yes. We've added a lot of new service the last 5 or 6 years to really enhance what we offer so people don't have to drive to the valley. We just a couple years ago spent $5.5 million on the Cancer Center. We signed an agreement with Banner MD Anderson to have an affiliation, so things that we can't handle here, they have a one-stop shop down at Banner MD Anderson. They have a navigator assigned to us. And then as recently as June of this year, we had our Cancer Center accredited by the American College of Surgeons as a center of excellence. So we offer state-of-the-art cancer care. We have Dr. Thacker, who oversees the Cancer Center as the medical director, and we offer chemotherapy services as well as radiation therapy services. So that's been a new addition. Probably the biggest thing is we brought in 50 new physicians to the mountain. When I got here, we only had 3 employed physicians. Most of the new docs want to be employed. So we've recruited 50 new physicians, added the specialties here to expand services. A good example would be our cath lab. When I got here, the cath lab was on a tractor trailer. You had to go out in the cold, and there was a lift gate that lifted you up into the back of a 40-foot trailer. And then we graduated to a single modular building that we attached to the surgery, and we had the doctors fighting over it because it was, the surgeons wanted it and the cardiologists wanted it. And finally the board said, no, it's built and added on. So we spent $12.5 million, added 25,000 square feet, and built a state-of-the-art cath lab. We have a hybrid cath lab that our vascular surgeon uses, and then we have a dedicated cardiology cath lab that our 2 interventional cardiologists use, as well as our invasive. So that's been a huge improvement. We have state-of-the-art cancer care with $12.5 million spent. We're also offering 24/7 cardiology coverage. So if you need heart care at any time here on the mountain, there's a cardiologist on call, and we have a cath lab to take care of their needs, and it's no longer a lift gate.
Right.
So that's been a big. The atrium, if you remember, that used to be a courtyard, and so we've now made that a walkway. We have a new laboratory, new cardiopulmonary, new physical therapy, new women's imaging, new physical therapy. That's all been in the last 3 years. A new pharmacy has been in the last 3 years. Probably the one most noticeable to the community was the 2-year project to upgrade our emergency room. When I came, we had 16 cubicle curtains, not a lot of privacy, and now we have 31 private rooms. We have 4 large trauma rooms. We've grown from about 24,000 visits up to about 33,000 visits in the ER, and that's really our front door, but a really state-of-the-art emergency room. The last area, and we're about through replacing the hospital, is just a couple areas in radiology. Will be done by June, and then we're replacing all the boilers and chillers from the original hospital. That'll be done by October. But come October, the old original hospital will be totally replaced. Everything in it's replaced and updated and modern, and we have the doctors here, like I said, the new specialists here that really allow you to stay home for health care.
In that way. One of the partnerships that we've always enjoyed is things that we're able to do together, coordinate together. I know Summit's great with things in the community, what you're offering, what you participate in with the Chamber of Commerce, Sholo Days, some of the events that we have of just supporting and contributing back to the community. When you guys got ready to do this project, I know that you were able to take advantage of our Industrial Development Authority. What that is, it's a program that's a nonprofit corporation that allows you to take access of some of the bonding, which you're able then to go out and get a lower interest rate a little bit by using that. And that was able to kind of a partnership between you and the city, which helped you guys in your financing, being able to get a little better interest rates on your
that was
your
a big win for us, because we have tax-exempt financing as well as taxable financing, and by going through the Industrial Development Authority, we were able to get an interest rate all in just under 3%. The taxable rate was around 4.25%. The savings to the hospital on the debt service payments was $7 million by going through the Industrial Development Authority. So a big shout out to the IDA and the City Council for allowing us to access that funding. We borrowed roughly, probably about $38 million on tax-exempt financing and about $8 million on taxable financing, but it saved us $7 million by being able to work with the city.
That's great. Well, it's one of those things that's available there, and we appreciate being able to do that. It's one of the things that obviously you're a large, probably the largest, you are the largest employer in the White Mountains, and that contributes back to those people who are shopping locally here, and all of those things go together. For what we're able to have, and a lot of our seniors that visit the area, they're staying longer and enjoying it more. And healthcare is one of the largest concerns that people have when they come to an area. What do we have for education? What do we have for healthcare? And what do we have for recreation? And I think by making that one pillar stronger in our community, it's definitely going to help.
We anticipate moving into our new buildings the first quarter next year. So March, we should be occupying, maybe some as early as January, but we ought to all be moved in by the end of the first quarter. So that's a real aggressive project.
The blame it on you guys is why it hasn't snowed or rained, because it's been able to give you a pretty good head start on your project. Normally, if we would have had the snows and the rains, I'm not sure you guys would be as far along as you are right now.
No, we're about 3 weeks ahead of schedule because of the weather. One of the other new services that we are providing is we signed an agreement with Mayo Clinic December of 2017, where we applied. It took us an 18-month process, but we were accepted as a member of the Mayo Clinic Care Network, and they're very guarded in who they let in. And we're one of 40 hospitals in the nation that have been allowed to be a participant. And what Mayo did is they come up and looked at our quality of care, our patient safety, and they found that our quality and care, patient safety for the things we do are as good as what Mayo does in the Valley. And because of our Mayo Clinic Care relationship, we're able to co-brand. You'll see our logo and Mayo's logo in the hospital, and they're very proud that we're in their network and our quality of care. CMS ranks hospitals on a scale of 1 to 5, 1 star being bad, 5 star being the best. Very, very hard to get a 5-star rating. Only 6 hospitals in Arizona are 5-star rated, and Summit is one of the 5 stars. No hospital in Tucson, Flagstaff is 5 stars. Only 4 in Phoenix, including Mayo. And then Verde Valley and Cottonwood's the only other rural hospital. So
kudos
we're
to you guys.
extremely pleased with that star rating. Another new service that's really gotten a lot of traction in the last 3 or 4 months is what's called MD Save. Most of the employers up here are on high deductible health plans, and so employees shop for those services that they're going to have to pay out of pocket on an outpatient basis, like CT, MRIs, almost any of the imaging services. And what's been happening, they've been going to the Valley, to the freestanding imaging centers, and getting them at a significant discount compared to our inpatient prices. Beginning in November of this year, we offered what's called MD Save, where you can go online and buy the same services here on a cash basis as what you would pay in the Valley. And in the 2.5 months we've had that open, 3 months, we've had 249 people go online. The most requested service is an MRI with contrast, getting it for $500, $600, $700, where the inpatient charges are around $6,000.
Wow.
And that's been an area that the board is focused on, and it's kind of caused some bad community. Why do I have to go to the Valley to get it cheaper here? It's caused some bad public relations, and we have finally addressed that with this program, that you can get the same pricing as you get as a freestanding imaging center. When we compare our inpatient pricing with other hospitals, we're the 4th cheapest hospital in the state. But when people looking at an MRI CT for hospital pricing, it was a lot more than the imaging centers in the Valley. And so we made that available and marketing that really heavy, so those that can get the same cash pricing as what you pay in the Valley.
Oh, that's fantastic. That's huge.
It is huge. It's really.
I'm going to tell you, I wish I knew about that recently. My wife had one of those done, and
we just did a presentation to the 6 school districts and MPC last week, and they asked for enough to send to all their employees. We have a brochure that, and we've given it to the city too. I believe Ed and Stephanie have it, they've got enough brochures, because that's the #1 complaint we heard is, why can I go to the Valley and get this cheaper than at Summit? And we've taken that off the table.
Well, that's fantastic. So it sounds like you guys, obviously have a ton of stuff going on, and I'm sure after you get this built out, there'll be, like you say, you have room for further expansions, and you guys are, constantly, one of the things that's changing in our country is healthcare and the services that are available and provided, and it's nice to know that we have a facility here that can take care of us.
Yeah, we're very pleased to offer the depth and breadth of services here. We're a well-kept secret here on the mountain of what we can do.
Well, we sure appreciate having you today, Ron, and thank you so much for you, your staff, and your employees, what you do for our community.
Well, and thank you, and thank you to our governing board. We have a great governing board that makes all this possible, and they're very visionary and out leading us and challenging us to provide these services to the community.
That's great. Well, thanks so much.
Thank you.
Thank you for joining us on Inside City Hall today. We hope you have a fantastic day.